Hi, my name is Kayla Hinckley and welcome to my crash course on schizotypal personality disorder. Let's begin. SPD is a disorder that affects the DSM-5. It is a mental disorder similar to schizophrenia because of certain symptoms that occur. SPD is categorized in patients with severe social anxiety, thought disorder, paranoid ideation, derealization, transient psychosis, and other unorthodox beliefs. People who usually suffer from this personality disorder are described as unusual and lack intimate relationships with people. Although it is a chronic disorder, patients can receive therapy and medications to help cope with the symptoms. Also, patients should consult a doctor to determine if medication is essential for treatment purposes, and also consulting a doctor is necessary to determine the severity of the mental illness. Now let's move on to the diagnostic criteria that's consistent with that of the DSM-5. The symptoms are formed by certain ways the patient can suffer from the disorder, which includes unusual perpetual experiences, somatic illusions, unconventional thinking or speech, paranoid quasi-delusional ideas, unusual appearance, inappropriate behavior, lack of close relationships, excluding family, social anxiety, and paranoid fears. For a diagnosis of SPD, patients are required to meet 5 out of the 9 stated criteria. To receive a proper diagnosis, a doctor will consult the patient about their present symptoms and analyze personal, medical, and family history. They must also be prepared to answer questions about their personal medical history, such as the medication and dosage, and if they had any other symptoms. SPD is usually diagnosed by a mental health professional because there is not a laboratory test to determine it yet. It is a lifelong problem, but with the proper treatment, symptoms can be controlled through therapy and other coping mechanisms. The symptoms for this disorder are constantly present and do not come in episodes like panic attacks. Possible causes of SPD are not fully identified yet, but scientists do have some possible contributing factors that could play a role. It is a personality disorder, and that is based upon the individual's personal thoughts, behaviors, and emotions. Personality forms during childhood, and that is developed by the surroundings of the child, such as home life or peers. Possible causes could include genetics, childhood trauma, verbal abuse, high reactivity, and societal pressure from peers. Genetically, researchers are looking into how aggression, anxiety, and fear affect people, since these are huge factors in other personality disorders. Childhood trauma plays a huge part because there are roles between these traumas and personality disorders that offer that they coincide. In a study by the APA, there were 793 mothers and children, and the mothers were asked if they had ever screamed at their children or verbally told them they did not love them or threatened to kick them out. The children who had experienced this situation were 3 times more likely to develop a personality disorder in adulthood than other children. Let's discuss treatment options. SPD is often treated with psychotherapy and medication simultaneously. Psychotherapy is where a patient is treated for their psychological state rather than their medical state. Types of psychotherapy include cognitive behavioral therapy, which is changing the thought patterns, learning social skills, and modifying their behavior. Therapy is usually the first step in controlling symptoms of SPD, just like many other mental illnesses. After the therapist analyzes the patient, medications will be determined for proper form of treatment. However, the FDA does not have a certain drug for patients yet, but doctors often prescribe antidepressants, antipsychotics, anxiety, or mood stabilizers in hopes to reduce the symptoms. It is good that there are treatment options available for people who suffer from SPD, but the effectiveness of the treatment is still understudied. That is due to the fact that people who suffer from this disorder often distrust people and are usually very uninterested, so they don't seek out the help they need. But when individuals do seek out the help for this treatment, it is important that the therapist establishes a relationship where the patient can feel comfortable in the setting provided. And during these therapy sessions, it is important to target the set symptoms at hand instead of working on underlying issues. When going through these invasive therapies, it is important that the patient sets the rules for what they are comfortable with, and over time, they can learn to adapt to the new changes being made. If you couldn't tell by now, patients with SPD have a lack of normal social skills. Some normal social skills include identifying well with others, communication, greater efficiency of the people who surround you, being proactive in career choices, and having an overall happy mental state. In a study by 2 Russian scientists in 1996, they showed that patients with SPD had mild deficits when recognizing facial expressions as compared to a healthy human being. Other deficits included informational processing and attentional deficits, which prohibit daily functioning. Following this discovery, 2 scientists from Johns Hopkins University in 2002 performed a study which showed that participants were asked to do a social role play task, and people who suffer from SPD failed because they do not know how to act properly in certain situations. The end results of this study showed that individuals with SPD have similar deficits to those present with schizophrenia. In a follow-up report in 2002 by a Schizotypal model, it showed that patients with SPD had a higher probability of only receiving a high school education. 53.9% had self-related occupational impairment and 40.7% were disabled. Like the study by the Johns Hopkins scientists, the Schizotypal model found out that SPD patients mimic the social, occupational, and cognitive skills, particularly in the area of verbal measures. If you've been listening, you've come to the fact that SPD and schizophrenia are very similar. SPD is not widely talked about, but in close relationship to schizophrenia, which is a disorder that affects how a person thinks, behaves, or feels appropriately. Patients are often misdiagnosed with schizophrenia because of how similar they are in the start. SPD does not have all the compounds schizophrenic patients have, but the cognitive deficits and executive functioning are like one another. The DSM-5 criteria has shown that symptoms are most common during the prodromal phase of schizophrenia. Let's continue. So since the 1980s, research has shown that patients with SPD carry the same biological and neurophysiological factors as patients with schizophrenia. That includes eye tracking impairment, evoked behavior, and attentional deficits. A key distinction of the two is someone who suffers from schizophrenia will not be able to decipher the real world from their delusions and often not act off of their impulses. People with SPD, however, only have many episodes of this, an example being that individuals with this disorder usually feel like outsiders, but they know the reason behind it is because of their mental state, which makes it less severe. Now, I know what you're wondering. What is it like to live with SPD? And I'm here to tell you, it can be very frustrating and it is very difficult. But it is manageable. Keyword, manageable. Living with this disorder is a shocking diagnosis for most people because it is not widely talked about. They feel as if their behavior was a part of their personality. They never realized that they had a mental illness. Since it is proven that they lack basic social skills to create friendships, patients have claimed to want personal relationships outside of their immediate family realm. But considering their severe social deficits, trying to connect on a personal level with people is a task they just don't even attempt. It is so important to note that this is not an illness you'll be able to diagnose yourself with at home. But if you're feeling any of the symptoms associated with SPD, it is crucial to consult a doctor and y'all can figure out a treatment plan and what's best for you and your lifestyle. I know that was a load of information, but let's do a quick recap of what we learned. SPD is when an individual suffers from social anxiety, thought disorder, paranoid ideation, derealization, transient psychosis, and other unorthodox beliefs. Patients are not usually diagnosed until early adulthood, and from that point, they can begin treatment to live out their everyday life. Although this is a chronic disorder, it is very good to know that there are therapies and medications to help lessen these symptoms. And it is not widely talked about, but often misinterpreted into having schizophrenia. But there are key differences that make these disorders unique in themselves. They have set treatment plans as well, so it's imperative to consult with a doctor if you experience 5 out of the 9 criteria. Now, thank you for listening to my crash course on schizotypal personality disorder. Bye.